Hi, my name is Joanna and I'm going to be conducting a cardiac examination. I'm going to wash my hands. First, I'm going to identify the 6 precordial areas. First one is the aortic, which is the second intercostal space right to the mid-sternal border. This is where S2 is hurt the best. Second one is the pulmonic. This is the second intercostal space left to the mid-sternal border. This is where split S2 is hurt the best. Third one is the Erb's point, which is the third intercostal space left to the sternal border. Fourth one is the tricuspid, which is the fourth intercostal space left to the mid-sternal border. And this is where split S1 is hurt the best. Fifth one is the mitral. This is the fifth intercostal space. Let me find it here. Mid-clavicular line. This is where S1 is hurt the best. And then this is the epigastric area, right below the xiphoid process, slightly to the left. This is where a pulsation is felt if there will be a heart hypertrophy. Also, S4, S3, and a mitral valve prolapse would be here at the mitral area if the patient will be in left lateral decubitus position. Other murmurs that can be heard would be mitral regurgitation and aortic stenosis, and both would be heard during systole. Next, I'm going to tell you how to perform a squat test. Please have a seat. Thank you. The squat test is performed. It would be listened in the mitral area. Patient would be standing. So we would be listening, and as the patient's squatting, we would be listening to a click. And if the click diminishes, that means there's a mitral valve prolapse. But if the click accentuates, that means that we can hear the aortic stenosis. We would be hearing the opening snap from the aortic stenosis. The other test I'm going to show you how to perform will be the Valsalva maneuver. Please lay down again. Thank you. Valsalva maneuver, again, would be listening to the mitral area, or the external border. We would place over the abdomen our hand, and then we would ask the patient to bear down or strain as if she was to have a bowel movement. Now, if the sound would become louder while the patient's straining, that means mitral valve prolapse. But if the sound diminishes, that means it could be aortic stenosis. And now we're going to inspect the 5 points, where we're going to be looking for pulsations, lifts, or heaves. And then palpate as well. We would palpate lifts or heaves with the pad of our fingers. We would do the 5 precordial points. And then for palpation, we would use the ball of our hands. We would use the 5 precordial points. If we were to feel any vibrations, sensations, that could possibly mean there's a heart murmur, so then we would have to listen more closely. Then now we're going to listen to the apical pulse, which is the 5th intercostal space, again, mid-clavicular line. This is also referred as the pulse of maximal impulse. We would look for a pulsation. Let me see here. That would be about 2 to 3 centimeters wide. We would make sure it's brisk and is usually heard 2/3 of systole. Now, if the apical impulse is laterally displaced, that could mean there's a pregnancy or an enlarged heart, also cardiomyopathy or ischemic heart disease. If there's a larger area or there's a diffuse apical pulse, that means there's an enlarged heart. If the apical pulse is sustained, that could mean left ventricular hypertrophy. Or if the patient is hyperdynamic or hyperkinetic, that is normal in young people, or persons have had recent exercise. It also could indicate hyperthyroidism, anemia, aortic stenosis, or aortic regurgitation. Now I'm gonna auscultate the 5 precordial points. I'm gonna be using the diaphragm and the bell of my stethoscope. First, we're gonna do it with the patient supine. We're gonna use the diaphragm. We're gonna auscultate, looking for S1, S2, or any other sounds. Now I'm gonna be using the bell of the stethoscope. Now I'm gonna have the patient turn to the left for a left lateral decubitus position. So just right this way, please. Thank you. In this way, I'm also gonna be listening, auscultating with the diaphragm first. Then I'm gonna be listening with the bell. Okay. Then I'm gonna have the patient sit up and lean forward. Again, I'll be listening to the 5 points. I'll be using the diaphragm first. Oh, sorry, lean forward, just like that. Then I'll be using the bell. And now I'm gonna auscultate for some of the arteries. I'm gonna have her lay back down. First, I'm gonna do the carotids. I'll be using the bell of the stethoscope. I'm gonna ask her to please hold her breath. So just hold your breath. Now I'll be listening for bruits. Then I'm gonna listen to the abdominal aorta, which would be located between the xiphoid process and the umbilicus. Again, using the bell. Then I'm gonna listen to the renal, which would be slightly lateral to midline. These are the renal arteries. Then the iliac, which would be right below the umbilicus, bilateral to lateral, a little bit lateral to midline. And lastly, I'll be looking for the femoral arteries, which would be halfway the superior iliac crest and the pubis symphysis right within the groin area. Now I'll be listening with my bell as well, bilateral sides. And that is all for the cardiac exam. Thank you. ¿Lo paré? No sé, porque está un FaceTime.